Well, if you live in a tropical country, chances are you've had your fair share of mosquito bites and even heard of dengue fever.
That's right. You may also know someone who has suffered from the mosquito-borne disease. The World Health Organization lists dengue as one of the fastest-growing global health threats.
The WHO estimates that 100 million people contract the disease each year. As temperatures rise in Singapore, more dengue cases are also being reported.
Well, and across the causeway, Malaysia is experiencing its worst ever outbreak. Dengue is also on the rise in other Southeast Asian countries, including Thailand, Myanmar, and Vietnam.
So here to give us a fact check this morning and to tell us more, Dr. Leong Ho Nam, infectious disease specialist from Mount Elizabeth Novena Hospital.
And Professor Annalise Wilder-Smith, an infectious diseases professor from the Lee Kong Chian School of Medicine. Welcome to both of you.
Good morning. All right, Professor, let's start with you. Can you explain the link between rising temperatures and the spike in dengue cases in the region?
So rising temperatures are one of the reasons for the spike in cases that we've seen in recent years and decades. But it's only one of the main reasons. But let's explain or try to explain why temperature has such an effect on vectors. So the mosquitoes for dengue are Aedes mosquitoes, and they go through 4 stages, from the eggs to the larvae, to the pupae, to the adults. And these stages are highly temperature dependent or temperature driven. It's not only temperature, it's also rainfall. So we also need sufficient amounts of water for the Aedes to grow. So because it's a temperature driven, so under the right temperature conditions, the vector, the Aedes mosquitoes, live longer and also multiply faster.
Well, and Dr. Leong, we know about 4 strains of dengue. Which ones are present in Singapore?
We see all 4 strains, but it's just 1 and 2 that stands out more predominantly. We had a few years ago, we had dengue 3 as well, but predominantly it's 1 and 2. Once in a while, we get a 4.
Can you tell us the difference between the strains?
Just in summary, there's actually quite different subtypes. They're all dengue viruses, but they are quite different. Having had 1 dengue infection doesn't give you immunity to the other one. So in fact, you can have 4 dengue infections in your lifetime.
Is one more dangerous than the other, or are they?
There are certain, even within dengue 1 and 2, there are certain subtypes which will predispose a person to a more severe infection. And there's a hypothesis that if you have the second dengue infection, if it's the right subtype, it may actually make things worse.
What causes the switch? Is there kind of variations between the serotypes?
I think they're always circulating, and it's a fight among the dengue viruses as to which is the one that will come up predominant. And they'll be competing for hosts. But if a person has been bitten, if the large majority in the population has been bitten, then that dengue virus will be less effective. And we call that as herd immunity. So if those who have not been coming up will use this opportunity to come up with more dengue infections.
All right, Professor, explain to us, though, as we were talking about earlier, the rates in Singapore is slightly less than previous years, but in Malaysia, they are experiencing their worst outbreak. Why do you think that is so?
So epidemics come and go, are often unpredictable. We see almost a cyclical pattern every 3 to 5 years. Currently, Malaysia is experiencing a peak. We saw a big peak in Singapore in 2013 and 14. Earlier this year, we saw a clear decline, fewer numbers in dengue compared to last year. But all over Southeast Asia, currently, they're experiencing an upsurge. Vietnam saw a 25% increase. Thailand is experiencing a dengue outbreak. So dengue is a problem currently in Southeast Asia.
Well, yeah, go ahead.
Is there something that we can do, government agencies or health agencies can do to lessen the outbreak in any particular region, knowing what causes, temperature and water and all that?
So in the absence of a vaccine, several interventions can be done or should be done. One on the community level, so for all of us to participate and contribute to reducing dengue, but also on the governmental level. And that includes various interventions, for example, environmental changes, targeting the breeding sites, which is probably the most important part in vector control, a reactive fogging of adult mosquitoes, and also early detection of dengue cases. Because remember, the reservoir are also in humans. When we carry the virus, that's the time when the mosquito bites us, takes up the virus from our blood, and then gives the virus then to the next person during the next bite.
Well, speaking of this spreading situation, let's go back to what's happening in Malaysia. Now, doctor, it's actually a new strain that's led to a higher death rate. We heard about 3 more deaths in Johor just last week. Any cause of concern about it coming to Singapore or in surrounding countries?
I think if we were to travel to the surrounding countries, we may bring the virus back into Singapore, but I think we should be able to control it. I think the government and the National Environment Agency has everything under control with the Mosquito Wipeout controlling it. I think the point is there's an over-reliance on the government in actually controlling the mosquito breeding sites. But if we push the responsibility to the individual self, this is your house, this is your neighborhood, you look after it well, you get rid of the place at which the mosquitoes can breed, we collectively can make a difference in actually preventing the spread of dengue. Instead of being reactive with fuming, fogging, I think push the responsibility into our own selves, into our own house, and the neighborhood. Everyone takes charge of your own neighborhood, and collectively, we can keep the mosquito at bay.
But what about a vaccine? Right? What's the situation there? Why is it so challenging to come up with a vaccine for, a common situation like dengue?
So there are very good efforts in dengue vaccine development. Various candidates look very, very promising. In fact, one dengue vaccine candidate is going to be submitted for licensure this year. So we actually have moved ahead quite a bit, and maybe in the near future we'll see a vaccine.
So we're always hopeful for that. Doctor, you wanted to say
that
something?
vaccine took 10 years in development. Okay, there are other candidates coming up, and I must admit that that vaccine is not perfect, but it's the next best thing available, and we do love to see it come in together with individuals, with the government, and a vaccine, mosquito control. I think we can control it.
Well, perhaps we can just get rid of the Aedes mosquito as well. That's another option. Brutal one. But thank you very much for joining us this morning, Professor Annalise and Dr. Leong.
All right. Well, thank you again to both of them.